Commonly ordered 10 blood investigations, which includes CBC, complete blood count, basic metabolic panel or basic electrolyte panel, which includes most common 7 electrolytes: sodium, potassium, chloride, carbon dioxide, blood urea nitrogen, creatinine, and glucose, which is often referred to as Chem 7. Next comes comprehensive metabolic panel. This includes additional electrolytes, which are calcium, total protein, albumin, bilirubin, alkaline phosphatase, aspartate transaminase, alanine transaminase. So total of these 14 electrolytes are referred to as Chem 14. Next comes the lipid profile. The test measures the different types of cholesterol, which includes total cholesterol, high density lipoprotein, low density lipoprotein, and triglycerides. This is usually used to evaluate cardiovascular risk. Number 5 is thyroid function test, and most commonly used tests are TSH value and free T4. Number 6, analysis of vitamin B12, which includes the serum B12 level and methylmalonic acid. HbA1c is glycated hemoglobin, the test order to monitor the blood sugar control for diabetic patients. Number 8, prothrombin time and international nationalized ratio. These tests are used as a measure of how quickly the person's blood clots. BNP is brain natriuretic peptide, and number 10 is analysis of ferritin level. These are the common 10 blood investigations. Moving on to CBC, complete blood count. This includes collection of tests related to the cells in the body, which are white blood cell count, red blood cell count, hemoglobin, hematocrit or packed cell volume, MCV, mean corpuscular volume, and platelet count. Moving on to the Rbc count. What is the normal level of white blood cell count? At birth it is 20,000 cells per cubic millimeter, whereas in adults it ranges from 4,000 to 11,000. Increase in white blood cell count is called leukocytosis, which is normally seen in newborn, pregnancy, during menstruation, and lactation. Apart from these physiological conditions, it is also increased in pyogenic or pyrogenic fever. Leukemia, it is a cancerous condition where there is marked increase in white blood cell count, which is more than 50,000 cells per cubic millimeter. What is decreased white blood cell count named as? It is leukopenia. So the cells are less than 4,000, normally seen during starvation and at night times. Apart from the physiological conditions, It is markedly reduced in typhoid fever, viral infections or protozoal infections, and mainly in bone marrow depression. Next component in CBC is Rbc count. The normal range of red blood cells at birth, it is 6 to 7 million cells. In adults, it is 5 to 6 million in males and 4.5 to 5.5 million cells in females. And normal lifespan of the red blood cell is 120 days. So what are the conditions where Rbc count is increased? It is increased mainly in a condition called polycythemic vera, where there is more than 6 million cells per cubic millimeter, and it is reduced in anemia. Next component in CBC is hemoglobin. So what is the normal level of hemoglobin? At birth it is 23 gram percent due to increase in Rbc count. By the end of 3 months it reaches down to 10.5 gram percent due to lack of iron content in milk. By the end of 1 year it reaches 12.5 gram percent. And in adults 14 to 18 gram percent in males and 12 to 15 gram percent in females. So what are the types of hemoglobin? They are adult hemoglobin, which is HbA, fetal hemoglobin HbF, oxyhemoglobin HbO2, reduced hemoglobin. Here the oxygen is removed in the blood. Carboxyhemoglobin, when the hemoglobin combines with carbon monoxide. Carbaminohemoglobin, when it combines with carbon dioxide. Methemoglobin, when the ferrous ion is oxidized to ferric. HbS is seen in sickle cell disease. Moving on to hematocrit. Hematocrit is also called packed cell volume, and this can be referred as volume of cellular elements per unit volume of whole blood. What is the normal level of PCV? In men it is 45%, in women 42%. This is the average value. So increase in packed cell volume increases the viscosity of blood, and what happens? Eventually there is decrease in blood circulation. So what are the conditions where PCV is increased? It is increased in polycythemia, where there is increased Rbc count, congestive heart failure, protein shock conditions like burns, dehydration, and the viscosity of blood is reduced in anemia, bone marrow depression. What is MCV? MCV stands for mean corpuscular volume, and this test is ordered to analyze the morphology of red blood cells. And this can be calculated with packed cell volume per 100 ml of blood by Rbc count into 10. Average packed cell volume is 45% and Rbc count is 5 millions into 10 is 90. The normal range of MCV is 78 to 94. So when the Rbc has normal mean corpuscular volume. They are named as normocytes. Red blood cell with increased MCV is macrocytes, and red blood cell with reduced MCV, they are called microcytes. So what are the conditions where there is normocytic anemia? After acute hemorrhage, all hemolytic anemias except thalassemia, and aplastic anemia. Macrocytic anemia is seen in megaloblastic types where there is deficiency of vitamin B12 and folic acid. IF stands for intrinsic factor. And macrocytic anemia is also seen secondary to any liver disease. Microcytic type is most commonly seen in iron deficiency anemia and thalassemia. Next component under CBC is platelet count. What is the normal platelet count? It ranges from 1.5 to 4 lakhs per cubic millimeter, and the platelet count is very much constant. Lifespan of platelets, they range from 8 to 12 days. They get destroyed in spleen. So in a condition called hypersplenism, almost the platelets disappear in circulation. Increase in platelet count is called thrombocytosis, which is seen after the injection of epinephrine, after any trauma like surgery, injury, or after child labor. Removal of spleen and during stress. Platelet counts are markedly decreased, that is thrombocytopenia, seen in bone marrow depression, hypersplenism, viral infections, and any drug hypersensitivity. The most common viral infections, which is dengue.